The Department of Veterans Affairs motto is to care for him who shall have borne the battle. Since 1865, that's been the country's promise. But a new Inspector General report raises serious doubts about whether the VA has enough staff to keep it.
The VA promised to protect veterans' health care. But today, doctors, nurses, and medical staff are walking out the door. Not because they don't care, but because they can't take it anymore. Hospitals are short-staffed, morale is crumbling, and the people who serve this country are the ones paying the price, the veterans. What's up, guys? Welcome back to Military Insider Show. All right, across the nation, VA hospitals are losing staff at a record speed. I want to make sure that you guys drop your comments below. Let me know if you are visiting VA medical centers, if you think they're short-staffed, if you think you are waiting longer than usual, let me know, okay? Over 800 doctors, more than 2,000 nurses, and countless mental health specialists have left since the start of the year. Why? Overwork, burnout, hiring freeze, and broken promises. You know, early this year, a lot of federal positions got cut, and they took the furlough up to September 30th, which was the fiscal year. But the same VA that vowed to protect care for veterans is quietly cutting positions and losing its backbone, the people who actually do the work. All right, so I found this report yesterday. It says, despite vow to protect health care for veterans, VA losing doctors and nurses. Impact of understaffing, facility closures, and waiting time has been dire. All right, let's see what we got here. Our staffing in the ER is beyond dire now, said Heather Fallon, a nurse in the emergency department at the Captain James A. Lovell Federal Healthcare Center in North Chicago, who had long been dreading the arrival of September 30th, the day the fiscal year came to an end. Pretty much, you will see this across the federal department. People took the furlough early this year, and then pretty much they were working. I mean, they were not working. They were just at their house collecting a paycheck all the way to September 30th. That was the day she said she lost 2 nurses, and the facility lost 9 staffers in total, whose contracts ended, putting further strain on her team, which has seen an increase in patients this year. Veterans Affairs Secretary Doug Collins had vowed to have reduced the size of the agency by 30,000 positions by that date without impacting health service for veterans. He's saying that he was going to cut 30,000 positions without impacting health care for veterans. But now we have a doctor here saying that she's been short-staffed up in Chicago. Let me know in the comments how you guys are seeing the VA clinics. Let me know if you think you've been waiting longer than usual. Do you think there's a short staff, like doctors not coming to work, or I don't know, pretty much short staff personnel from the receptionist all the way to nurses and doctors? Let me know, how's your experience lately? We are understaffed, Fallon said. We don't have all of the services that we would have had on a regular basis. Meanwhile, wait time have increased for patients. That's what I was telling you guys that I want to know. Let me know, said Florence Yusuf-Buman, a nurse practitioner who works in primary care at a VA hospital outside of Atlanta. She also said that the staffing shortage has increased since September 30th. I mean, of course, it's going to increase. A lot of people got furloughed September 30th, which was the end of the fiscal year. And that an increase in patient had reduced the time available for outpatient from the recommended 1-hour visit to 30 minutes. So the time block for the appointment was supposed to be 1 hour. Now it's reduced to 30 minutes. Do you think you can do a lot in 30 minutes if you have a mental health appointment, or if you have, I don't know, back issues problem, or whatever the case? I really doubt you can do that in 30 minutes. But I want you to stay with me all the way to the end, because I have another report from CVS that is very, very important. She added that in many years of the hospital, including the Women's Health Wellness Clinic, there is reduced staffing. I am assigned the duties of 2 people Many of my coworkers told me they are putting an average of 4 hours unpaid daily just to keep up with the workload. Both Fallon and, I'm not going to say that last name, Yuzu, are speaking out as members of National Nurses United, largest union of registered nurses in the country, whose contract with the VA was terminated in early August. Let's continue on. Let's see what we got here. Let's take a look at this. But the upheaval caused by the Trump administration earlier firings or of probationary employees who were then rehired months later, the closing of some VA facilities, and the cancellation of medical research trials have had a major impact, says nurses who work at the VA facilities. Staffer at the Department of Veterans Advocates. Now, look at what Collins says. Collins had repeatedly vowed that cutting 30,000 positions won't directly impact health care or benefits for veterans provided by the VA clinic. Yeah, so this guy, Doug Collins, the VA secretary, he's saying that cutting 30,000 positions would not affect the veterans' care. What do you guys think? Do you think this guy is blind? Do you think he needs to go down on the field and check some VA clinics out so he can see them by himself? I think this is something that needs to be addressed and needs to get fixed, because I mean, we already know what's going on with Project 2025, and that's another video I'm going to be covering. But do not cut benefit for our veterans, including myself. Do not do that, okay? Now, this is from CBS News. It says staffing shortages at VA health system are on the rise. Watchdog finds. This was back on August 13. Look at this. Healthcare staffing shortages at the Department of the Veterans Affairs are on the rise, according to the new Watchdog report. In the report on Tuesday, the VA's Office of Inspector General, or the OIG, found Veterans Health Administration facility reported 4,434 staffing shortages this fiscal year alone, which is a 50% increase from fiscal year 2024. Almost 94% of facilities reported severe shortages of medical officers, while 79% of facilities reported severe shortages of nurses, according to the report. I don't know, but I think this backfire on this administration. The report's data comes from questionnaires sent to 139 VHA facilities comparing 2025 responses to 2018 through to 2024 responses. The 2025 questionnaires were distributed via email on March 26 with the required completion date of April 9th. Data on staffing shortages at VA facilities has been collected annually for over a decade. And the report notes that this is the 8th report to identify severe occupational staffing shortages at the facility level. So they sent a report out early this year to see how the VA facilities were working on without the personnel needed. And there you go. You have it right there. 94% of the facility reported severe shortages. The report notes that the OIG did not independently verify VHA data for accuracy or completeness. It also said that due to the timing of the questionnaire or any impact on staffing from OPM's deferred resignation program and VA's workforce reshaping efforts, which are expected to lead to further staffing shortages, were not fully reflected. So pretty much all those federal workers, VA doctors, nurses, staffing, all those are federal positions. And a lot of those guys, they couldn't stand the workload they were having, working for free almost 4 hours a day. They had to take the DRP, Deferred Resignation Program, the one that ended back in September 30th. So that's pretty much why all this VA clinic are seeing shortages. But I want you to let me know in the comments if you are going to VA clinic, regardless of the state you're in. Let me know in the comments. I want to see how other clinics are looking, and then we'll continue on. Thank you so much for your support. Make sure you hit that like, you hit that subscribe button. It really helped the channel out. And thank you so much for your support, and we'll see you on the next one.